I was unable to close my left eye. Now it's just the opposite. I'm having a lot more trouble keeping my left eye open. And now with the synkinesis, when I speak, if I move my lips to one side, my eye closes. If I chew, my eye closes. I lost the ability to manipulate food in my mouth. I could put it in, but if I tried to chew, nothing would go down on my left side. And, as a result, I just had to eat everything on my right side and chew on my right side. If I take large sips, everything closes down and all the muscles tighten up here.
Facial synkinesis is a facial movement disorder that arises as a permanent consequence of a severe episode of a facial paralysis, such as Bell's palsy, Ramsay-Hunt syndrome, Lyme disease-associated facial paralysis, or some types of surgeries.
One of the components of facial rehab is to help patients learn how to manage their synkinesis during functional activities. Functional activities like eating and drinking, something that they do commonly. And we want to teach people how to dial down their synkinesis so it's not impairing or impeding their functional movement patterns. So for example, when a patient's eating, I will recommend that they work on eating slowly, eating with smaller bites, and even eating softer foods. Less manipulation of the mouth while eating will dial down the degree of synkinesis. Because as you may have learned, synkinesis ramps up with higher level movements. So the bigger you move, the more pronounced the synkinesis is.
My work here in managing synkinesis started with muscular retraining, learning how to relax, learning how to be mindful at all times, and doing things like learning how to take smaller bites and taking smaller sips when you drink, all so you don't increase the amount of synkinesis that you go through.
Facial synkinesis is thought to result from the aberrant regeneration of facial nerve fibers to the various muscles of facial expression. And while there is no cure for facial synkinesis yet, there are effective treatment options for it, namely physical therapy, medicinal or functional Botox, and various surgical procedures. Botox is particularly effective for treatment of facial synkinesis, given the underlying problem is one of facial muscle hyperactivity. Each patient with facial synkinesis has a unique pattern of facial dysfunction. Administration of Botox is tailored to each individual's specific pattern. Botox can be injected into the forehead to improve eyebrow symmetry, can be injected around the eye to prevent involuntary eye closure, can be injected into the midface to reduce midfacial tightness, and in many cases improve smile aesthetics, and can be injected into the neck to relieve neck spasms.
Old way. Small sip. And now let me just make sure your whole lip is around it. Yep. Taking a bigger sip now. That's a good sign.
It goes all the way down. Yeah, the Botox loosens this up and down here, so it makes it much easier, to pass food through. I don't have that real tightness of my inner cheek pressing against my gums. After the Botox, it definitely became easier to eat. The muscles along here relaxed, and also down along my neck. I feel that I've really made progress. I'm able to do things that I wasn't able to do before. I'm able to smile without feeling self-conscious. I'm able to eat with other people without being self-conscious, and it's generally helped me resolve a lot of issues. And I feel more comfortable now, and certainly with a lot less pain.